So you establish a dashboard of metrics for the ER and the hospitalist. It's a shared dashboard. It represents the full continuum of care for the two service lines. And you establish a set of goals. What are we going to try to tackle in month one? What are we going to try to tackle in month two? And you just kind of work your way down the list. And through that process, not only do you create efficiency in the system and a happy patient and a happy family that experienced a well-oiled machine, but part and parcel to the whole improvement process is improving the documentation of care, potentially reducing the length of stay that the patient is actually in the hospital for an inpatient stay through utilization of best practices and order sets and different kinds of care things that are care-related therapies that are developed on a national level, so you don't have to basically make an individual judgment on everything, on every condition that a patient has. I mean, if they present with a certain thing, there's a certain set of therapies that are traditional for somebody with chest pain or this, that, or the other. So you start to apply those things, and so not only do you address the patient satisfaction, the efficiency side of things, which is always first and foremost, but there's an economic benefit for the hospital. You can really impact revenues, you can really impact cost to care for patients. So revenues are directly related to the quality of the documentation of the record. So you're working with your team on that. Cost savings is associated with how long are they going to be here? How long do we have to dedicate resources to take care of them? It used to be 4.5 days per patient. We've gotten it down to 3.5 days per patient. So we've reduced, the length of stay by, 23%. So we have to spend 23% less to take care of that patient than we did before we did this process. So you can start to really show a huge return on investment for the clients, it's just a model that we see as probably the cutting edge for people who do what we do in emergency medicine and hospital medicine. So Keystone is out in front with regard to doing that, certainly within our existing client base, and this is what we're selling and marketing to prospective new clients.